Good afternoon, everyone, and welcome to the weekly webinar brought to you by the Emergency Leadership Team. I'm Ruth Jackson with Academic Affairs, and I'm joined by Dean Joshua Busby and Vice President Teresa Powell. Thank you for joining us today as we re-engage with our weekly information. So in today's session, we will provide an overview, as we always do, by sharing our COVID-19 numbers and a status update. We'll talk about protocols and procedures that are now in place as we begin this new academic year. We'll spend some time discussing and sharing our campus operational posture. We'll have time for questions and end, as we always do, by reflecting on resilience. So I'll ask Dean Busby if he will provide our COVID-19 update. Dean?
Good afternoon, everybody. Thanks, Dr. Jackson, and welcome everybody back. And we're providing you with information as of noon on September 1st. And for those that are new to our webinars, you will see that we provide statewide cases, Logan County cases, and then cases for our campus as well. And so, as you can see, right now in the state of Oklahoma, we have a little bit over 550,000 total cases. Of that 550,000, 22 of those are active cases. And of course, sadly, we have to report, of course, that there are a little over 7,800 deaths statewide. And of course, this number statewide, of course, is since the onset of the pandemic. The Logan County number shows a little bit over 4,900 total cases. Active in that is only 265. And unfortunately, we've had 70 deaths in Logan County. For the Langston University, and this is for all 4 of our campuses, not just the Langston campus, but Oklahoma City, Tulsa, and Ardmore. We have had, and again, this is since we reopened in July of 2021. And so since the beginning of July, we have had 131 total cases, of which 61 of those are active cases. And so we define active cases as the cases that are currently in the quarantine protocol. Some, of those members of the university community will be looking to exit the protocol within the next couple of days if the screenings and everything that has been put in place, and we'll talk more about that here in a little bit, all of that checks out. And so 131 total cases, of which 61 of those are active. At this time, I will turn it over to Vice President Powell, who will give us an overview on our protocols and procedures for the campus. VP Powell.
Thank you, Dean Busby. All right, so just welcome everyone back. Thank you for joining us today. And we have a quick overview for you of some of the information that we're going to go over today. We requested questions in advance and got a lot of good suggestions and just questions that we've been collecting over the last few weeks. So we wanted to provide a good update that would inform the campus community on some of the inquiries that we've been receiving. So we want to thank everybody for their participation and suggestions that they provided. We will talk a little bit today about masks and face coverings. We've continued that conversation over the last several weeks. We'll talk again about vaccination and testing opportunities, the notification process for when someone tests positive for COVID-19, if they are symptomatic or if they are exposed to the virus, quarantine and isolation procedures. And we'll also talk a little bit about student absences and employee COVID sick leave. That'll be at the very end, and we'll leave some time for that. First, we want to talk with masks and face coverings. We are shifting our language slightly to align with that of the Oklahoma A&M system. We meet weekly as a system to discuss COVID-19 protocols and procedures, and decided that we can use the terminology expected. And we do expect that when you are in common areas, public spaces on any of our campus properties, we do expect individuals to wear masks. We still cannot require masks to be worn, and we certainly don't want to get into the business of enforcing a requirement because that would go against the state law and the executive order that is in place. But we do, of course, continue to strongly encourage masks, and we do want to start to make the shift of expecting masks to be worn. You'll start to see some of the language update to align with this language. You'll also see some of the signage be updated to match this language, and it takes some time to change all of that, but that's all in the process underway as we speak. Masks will continue to be made available and have been made available on our campus, all of our campuses, and we'll continue to do that as this semester is ongoing. And certainly we want to remind that those who come to the multi for COVID-19 testing or vaccination, we do consider that a patient-facing activity. And we do so in alignment with the state law and the executive order, which allows us to require masks in that environment. So we do just want to send a reminder. That's been in some of the messaging and language that you've seen released from the university, but we do want to make that reminder clear that it is a patient-facing activity and environment. So we do require masks in that space when you are coming to the multi, again, for testing or vaccination opportunity. We are getting some questions about, is it okay to pass masks out in the classroom or provide them in the classroom? And absolutely, we think that's a great idea. And we will be working to provide those masks in the classroom so that faculty, staff, students, everyone who needs access to masks will have those. So again, that is forthcoming and underway as well. Moving on to vaccination and testing opportunities, we are seeing really good interest from our students about getting the vaccine, and we're getting lots of questions about that via email or in person. So we are pleased by the interest we see there. We have created a survey that you can access through the QR code that's displayed on the screen. So we do encourage you to fill out that survey. That will give us an idea of the interest and also the date that interested individuals may be available to receive the vaccine. That helps us with planning because this is an external provider that we bring into the university to provide the vaccination. So we want to make sure that we have good dates and good data to share with them on the supply that they will need to bring along with them to support our community needs. The vaccine continues to be the best defense against COVID-19, and I think we're seeing a shift in especially in our student community and student population. They're becoming more interested and willing to receive the vaccine. It might be something that they just haven't thought about until now. It might be something they've been considering for a long time, and we have been having conversations with the SGA, and they're very supportive. We really appreciate the SGA and the SAB's support on encouraging vaccinations and educating our campus community and specifically our student population about the vaccine. We appreciate their partnership there, and that will be ongoing as well. Vaccinations are not a requirement for enrollment or employment at Langston University, and we want to make that very clear. We have not and will not be requiring the vaccine, again, because to do so would be out of compliance with the state law and the executive order in place that prohibits us rather from making those requirements effective for our faculty, staff, or students. We do strongly encourage them, and we are continuing our partnership with Total Wellness. They've been a tremendous partner in providing not only vaccination opportunities, but also the testing that we conduct on our campuses. And again, just a reminder to complete that survey of interest so that we can better serve the community needs. Moving on to testing, many of you have participated in that testing that we offer weekly in the multi-purpose gym, and we really appreciate your participation. I think that we have found that appointments are absolutely the way to go. They help us keep a steady cadence. They help us know what to expect on our staffing and our supply. So that will be our format moving forward, and it's been very successful. Our students have been just incredibly great about arriving on time and making sure that they're prepared. And so that has gone really well in the last few weeks, and it's happening actually today. As we are live with you on this webinar, we have testing and vaccinations ongoing today in the multipurpose gym. So just a reminder, and we've shared this with our student population, you've seen it in some of the messaging that we've put out. Testing is a great monitoring tool. It is a tool that we use to surveil the level of infection in the population. It is not, however, a means of prevention. And we've been very candid, especially with our SGA and SAB leadership, that we're seeing some behavior that really we want to try to shift. When students come to test and they get that negative test, it's natural to feel a sense of relief, and we see them almost celebrating, but we want to make sure that they understand that testing really just gives you a snapshot in time. It's just a moment in time. And the behavior is what we really want to make sure that we're practicing and creating a habit of wearing our mask, of getting vaccinated if we're willing and able to do so, of ensuring that we're keeping an appropriate social distance, of quarantining and isolating when it's appropriate to do so. Those behaviors are what's going to keep our campus community safe. So it's not the testing. We have seen some students sort of celebrate and get really excited when they get their negative test. And we want to encourage them to make sure that they maintain that negative diagnosis, that negative status. And the way to do that is through practicing those good health and safety protocols and behaviors that we have in place. Testing has been and continues to be in place for student athletes that are preparing for competition. And that is something that AD Rogers and her team have been extremely vigilant and committed to. And we really appreciate their assistance in making sure that we're keeping our student athletes safe and that they are ready for competition, and that we're maintaining the monitoring there that is needed. So that will be ongoing. We are decreasing our cadence of testing for student athletes who are vaccinated, and that is something that we're seeing sort of nationwide for collegiate athletics, and it's something that we have vetted with the system and with legal counsel, that we're able to reduce that frequency in testing for student athletes who are vaccinated. So it has been an incentive that we've seen for student athletes. They are, of course, becoming more interested in that vaccination. Some of them already are, of course, and they're able to decrease their frequency of testing, and we'll continue to support their needs and ensuring that they have access to that as needed. We will be continuing our requirement of a COVID-19 negative test for all residential students on a monthly basis. So we rolled this out last year. We had monthly testing for all students who resided on campus in campus housing. And again, that's just a surveillance mechanism to help us know if there are pockets of infection so that we can better mitigate that and ensure that we are isolating and quarantining appropriately. So we will continue that method and that approach. And I think our students are very willing and cooperative to do so. There's been a lot of interest and inquiries around that. So we will be continuing that and announcing those dates as we set those with our provider. We have at this time over 8,000 Binax Now rapid tests, which is the test we use to conduct COVID-19 testing on campus, on all of our campuses. So we have a great inventory to pull from, and we appreciate everyone's support and just being interested in receiving those tests and being willing to come to the multi, set that appointment, and make sure that they are helping us monitor that level of infection. So we appreciate the cooperation there. Optional testing will continue by appointment. We generally offer the testing on Wednesday. We try to expand that by a day or a day and a half when we can into Thursday. That's all dependent, of course, on the staffing levels that are available through our external provider, Total Wellness, who comes and administers and reports those testing results for us. So we work with them and try to really forecast out the need. That's why it's important that we have those appointments set so that we know what to expect and how to manage the number of students who are coming in for testing. And now Dean Busby will share more with us on the notification process should you test positive for COVID-19, have symptoms, or be exposed.
Thanks so much, VP, and thanks for that extensive information about our testing options and vaccinations and the like as well. And so to our campus community, and this information has gone out to the campus community, and it will continue to go out through the Office of Public Relations. But we have a notification process that this has been in place since the spring of 2020. And so we have a notification process, and we have a form. That QR code right there is actually the link. It'll take you the link to that form where you can actually complete that form if you should test positive. And then when I'm saying you, I'm talking about any member of the Langston University community, faculty, staff, or student on the Langston campus, Ardmore campus, Oklahoma City campus, or Tulsa campus. And so you can submit that notice of positive diagnosis through this notification. You can also submit a notice of symptoms if you're having symptoms as well. And there's also an option if you are a close exposure as well to someone who tested positive for COVID-19 as well through that same notification form. All of this you can submit a notice of positive diagnosis, a notice of symptoms if you're exhibiting any symptoms, or a notice of close exposure. And so we want to define, of course, exposure as being within 6 feet of someone who tested positive for longer than 15 minutes collectively at a time. And so this notification is received by members of our executive policy group, as well as our health clinic staff. That information is used to conduct our contact tracing, of which that information that follows the information that's being submitted. And then, of course, individuals, of course, anybody who submits the information will then receive appropriate follow-up and instruction from either the members of a member or or members of the EPG or the health clinic staff, either in person, via phone, or via email, utilizing all of those modes and communications for our community of scholars. And so that's it on the notification process. Again, we'll also send that information out and have sent that information out, continue to send that out through the Office of PR with the link as well. But we also have that QR code for you all who want to just have that handy if you need to and want to share it with someone in your department or your office area, or even your room, your dorm area, residential community. As it relates to quarantine and isolation, we recommend, and these are following CDC guidance, that you quarantine when you may have been exposed to COVID-19 through close contact. All right. So sometimes we use these words interchangeably. So we just want to define what those are, just as a point of information for our community. Isolate when you test positive for COVID-19, even if you are asymptomatic and even if you are fully vaccinated. So even if you're not exhibiting any symptoms at all, and even if you're fully vaccinated, you should still isolate. Close contact, again, as I stated, means being within 6 feet of someone that has tested positive, has a positive diagnosis of COVID-19 for a cumulative of 15 minutes or more over a 24-hour period. And so just want to make sure that that's clearly defined and articulated. And again, this comes directly from the Centers for Disease Control. So talk about our quarantine protocols. And so as it relates to quarantine protocols, we recommend, and this is in the case of those that have tested positive, is that you stay home for 14 days after your last contact with someone. And this is just on the quarantine. So not if you necessarily tested positive, but if you came in contact with someone who tested positive, or until you test negative, that you either stay home for 14 days or at least 5 days following that exposure with a negative test, right? And so what the research shows us is that if you're exposed today and you test tomorrow, you probably will test negative. But the research tells us that the virus will be traceable usually in the system in about 3 to 5 days or so. So that's why we're saying 5 days with no symptoms and a negative test. Fully vaccinated individuals do not need to quarantine following the exposure unless they are exhibiting symptoms. And of course, as you're monitoring your symptoms, please make sure to watch out for, of course, those fevers, the cough, the shortness of breath, and new loss of taste or smell, just to name a few. Students that are in quarantining or making a decision to quarantine are responsible themselves for notifying their instructors. Once again, students who decide to quarantine themselves are responsible for notifying their instructors. There will be no communications that's coming from the Office of Student Affairs, the Office of Academic Affairs, but students who are in quarantine, decide to quarantine on their own, are responsible for notifying their instructors. Now, let's talk about isolation. And so our isolation protocols state that an individual who tests positive that's in isolation should stay home in a separate room or area until it's safe to be around others. That's regardless of if it's a faculty or staff member who's at home with their family, if it's a student who's at home with their family, or they're on campus with roommates. Want to make sure that, of course, that individual monitors their symptoms and seek emergency medical care immediately if needed. Also, avoid contact with other members of the household as much as you can to limit that exposure and mitigate the spread or the risk of spreading in that area of the virus. You absolutely should wear a mask when around other people, but limit the activity also in the common areas as much as you can. So the living spaces, the kitchen, right, the restrooms and the like as well. And so as I talked about in quarantine, the difference in isolation, students that are in isolation, academic affairs will coordinate with the instructors for students in isolation. So the Division of Academic Affairs, the Office of Academic Affairs will send a notification to each one of the students' professors advising them essentially that the student will not be attending class physically and really be able to participate in any types of activities for the foreseeable future. And then Student Affairs will coordinate with dining to provide meals for any of our students that decide to remain in isolation on campus as well. All right. And so also in that isolation protocol, I also want to note that a member of our health clinic team will be reaching out to our students to check in with them, to monitor their health as well. And so our quarantine period is same as the CDC, is 7 days with a negative test and no symptoms, or 10 days with no symptoms. So even if a student or faculty or staff member, because that member from the health clinic will be checking in with them as well. But even if that faculty, staff, or student member tests negative on day 7, they still have to check their symptoms as well. And if they're not exhibiting any symptoms, then they'll be released from the isolation protocol. The notification will then be sent to the Office of Academic Affairs and Student Affairs, who Academic Affairs will then report to those professors, the students, professors, that they're now free to return to regular activities the next business day. And then, of course, Student Affairs will cease to deliver the meals to that particular student as well. So I just want to make sure that we were clear on what our isolation protocols are on campus as well. And so at this time, I will turn it over to Dr. Jackson, who will talk about our campus operational postures and give an overview there. Dr. Jackson?
Thanks, Dean. Before I move into our campus operations, I just want to expand a little bit on what Dean Busby talked about in terms of our notification process. So when a student has tested positive, as Dean Busby mentioned, all of the instructors with the student copied will receive an email from Academic Affairs indicating that the student will not be in class for a particular period of time. At the end of the isolation period, as determined by our health professional, a clearance email will be sent to the instructors and the students. So please be on the lookout for that information from LU Academic Affairs. If a student is quarantining, whether it's self-quarantine or quarantine based on campus testing and the recommendation of our healthcare professional, official notification will not be sent from LU Academic Affairs. So it is, as Dean Busby mentioned, the responsibility of the students to notify the instructor when they are quarantining, i.e. when they've been exposed to someone who has tested positive for COVID-19, or if they themselves are exhibiting symptoms. And so this was the reason for our shift, as I'll talk about a little bit more later, to our operational posture that includes hybrid instruction. I want to be really clear and reiterate that our posture right now focuses on hybrid instruction, which includes remote instruction, very different from online, where there is not an expectation that students will attend in person. So I also want to share something that came up in an earlier conversation. If a student is quarantining or isolating, that student not only should not attend class, but that student should not attend any work study or campus jobs that they have. Again, we're asking that the students take the responsibility to notify their supervisor in the case of quarantining or isolation, because the work supervisors will not be included in the messaging that's sent to the instructors. So I just wanted to share that and reiterate that process for everyone who is viewing. So as we shift to our operational posture overview, we just want to remind you that these are the operational postures that were defined last year based on recommendations and best practices at that time. We're in the process of continuing to review this based on the recommendations of legal counsel, collaboration among institutions throughout the state, and particularly within the A&M system. So I share that with the disclaimer that there may be some modifications made based on the information that we have at this time. But for the current moment, we are operating based on these levels. The first is level 1, and under level 1, it's business as usual. Traditional classes are held face-to-face. Campus events occur with no restrictions. There is regular occupancy in our residential apartments in our dorm, and it's business as usual. This is in the case where there is a low number of positive cases within the university community. The next level, level 2, is where we currently stand based on having active cases up to 3%. So as I just discussed, we're in the process of offering hybrid classes rather than the traditional face-to-face courses until further notice. What that means is instructors are heavily reliant upon Canvas and our CTUs that are located in many of the classrooms to connect with students, both in the class and those who are not in class, whether that means they're quarantining at home, quarantining on campus, or just on a day where they're rotated out of the class. Our goal is to decrease the number of people who are in the class and allow for the CDC recommended spacing. Now, one note that we shared earlier is for smaller classes that have the capacity to social distance based on CDC recommendations of 6 feet right now, those classes can continue to meet, but our priority is to make sure that we don't have too many students in a space where they cannot adequately social distance. In terms of events, there are enhanced protocols. So we know that we have the event task force that vets campus events that are suggested by students, faculty, and staff. And we ask that those protocols are outlined as well as safeguards are stated so that we can continue to offer events in a safer way. In terms of housing and operations, there are enhanced protocols that are in place. And we reduce the access to some of the operations on campus. This occurs if the campus, as I mentioned, if the campus has up to 3% active cases, again, active cases. The next level is level 3, and level 3 is a more restrictive posture where we shift to 100% remote instruction and courses that were previously designated as online courses. This occurs if the number of active cases goes up to 5%. In this instance, there are no in-person meetings or events. We shift completely to virtual events and meetings. Housing occupancy and enhanced protocols remain the same. We are more restrictive on who comes onto the campus, and then we'll shift a little bit to a more significant teleworking protocol. And of course, level 4 is if we reach the point where we are provided guidance by the state or county, where they issue safer at home bans. When our cases exceed 5%, then again, we go to the most restrictive posture, which is similar to where we were in the spring of 2020. So in level 3, I mentioned teleworking. I'll ask if VP Powell will talk a little bit about employee absences and teleworking guidelines, since I talked about our student position. VP?
Thank you, Dr. Jackson. Yes. And so last year, many of us will remember that we were afforded some specialized COVID-19 leave that was provided by the federal government under the Families First Coronavirus Response Act. That leave actually ended nationwide in December of 2020. So we're no longer afforded that type of leave. It's no longer allowable under the federal guidelines. So at this point, if any employee needs to quarantine at home, or if they need to isolate because of an illness or a diagnosis, then they would be, of course, just utilizing their leave as they would sick leave. If the sick leave is exhausted, then they would move to annual leave. Of course, always keeping in touch with your supervisor, letting them know, and using that notification form to let the university know so that we can make the appropriate notifications on our side and also complete contact tracing as appropriate there. For telework, we're really, we've asked everybody to be back on campus to the extent possible. There are still some accommodations in place that are by virtue of an ADA accommodation. That is something that is discussed with Student Employee Services directly. So we do have some accommodations still in place. And if you are looking for an accommodation either to be continued or a new accommodation, then that would be a conversation to have with Student Employee Services. And again, it would need to be related to a personal ADA accommodation that's required.
Thank you, VP. So at this point, we've reached the phase in the webinar where we pause to answer any questions that you may have. If you have them, please feel free to drop them in the chat or use the Q&A function.
And just as we're waiting for any information to come in, I think just to talk a little bit more as it relates to what Dr. Jackson was talking about with the operational posture. As of right now, we are right now restricting some of the student activity events on campus, but not all events. We are just wanting our organizations to understand and make sure that they provide us with an enhanced list of protocols and safeguards. And so we are not looking to shut anything down. I know one of the big things that somebody may be talking about is, hey, we got homecoming coming up right now, right? As of right now, we're planning for a in-person homecoming experience. But we don't know what the future looks like in a month and a half, but we are full steam ahead as it relates to planning. And so there may be some additional protocols, to help mitigate the spread on campus, because we know we're looking to have a lot of people that's planning to be here. I've already seen, people are posting their hotel confirmations and plane tickets and the like as well. So we know that our alum and friends are looking forward to returning to our campus. But just want you all to know that we are planning full steam ahead, but that there may be some strict protocols that are in place.
Thank you, Dean. We've received one question, and the question asks for a policy for instructors in regard to allowing freedom for the number of students attending the course. So in essence, we realized that there is no one size fits all approach that we could employ. So we're depending on the instructor in consultation with the department chair and dean to make that determination. The rule of thumb is generally half the class. If it allows for appropriate social distancing of 6 feet between the students and with the other members of the class learning remotely. I did mention that if there is a class that, for instance, some of our senior level courses may have smaller enrollments and be assigned to classrooms that are large enough for appropriate distancing, then it's possible for those classes to continue to meet 100% capacity. But the rule of thumb is to have these conversations with the department head as well as the dean and make sure that the accommodation of distancing can be adhered to. But the point is, every student who is not in isolation or quarantine should have the opportunity to attend an in-person portion of the class. Okay, we have another question about what are the sanitation efforts for the different departments? Dean Busby, would you like to take that one? You're on mute.
Lord, I'm sorry, just really talking away. So hopefully our departments are beginning to see some additional levels of visibility as it relates to the cleanliness of the office areas and the bathrooms and the common areas in your respective departments. Also, we are working with our partners at HES to establish a sanitization schedule for our large common areas. For example, the SSC, we know that's a large gathering space for our students relative to getting, to getting meals. We know the library is a large gathering space as well. And some of the common areas of our residential facilities, the laundry areas and different things like that, and the waiting areas there. We want to make sure that we have a set schedule for that. And so we're working with our partners now to finalize what that sanitization schedule will be. And as once we finalize that, we'll definitely be sharing that with our departments, of course, in the academic realm and the Division of Academic Affairs. All of that, of course, with those requests will need to flow up through your respective department heads, deans, and then, of course, ultimately to Dr. Jackson to make sure that everything is vetted and it's clear. And then we'll get that locked into the schedule. So just want to make sure that we speak to that. And so thanks for that question.
Thanks, Dean. There's another question about the responsibility. Whose responsibility is it for quarantine students? Again, it's the responsibility of the student to notify their instructors and supervisors of work study and on-campus jobs that they are quarantining or and if it's a student who is in isolation, then the Division of Academic Affairs contacts the instructors, but it's still the student's responsibility to contact any supervisors for student employment. We have another question about laptops. Some students are saying that they do not know how to access requests, and others are saying, who do they contact if they have not received a response to the laptop requests? So the easiest thing to do is to have the student follow up with an email to LUELT if they have made a request for a laptop but have not yet received that laptop or a response, and someone will follow up. But again, we want to continue to encourage our students to utilize our laptop rental program. If they do not have access to a computer, we like to remind them if they have Chromebooks, there are some limitations, and we really want to encourage them to secure one of the laptops. We have a link that we can provide, and we will share once again for students who need laptops. Again, if there are any questions about securing technology for a request that has already been made, please feel free to email LUELT@langston.edu.
Thanks, Dr. Jackson. I did drop the link for those students who, or for the individuals, especially our students who need to request a laptop. That's in the chat. So I would definitely implore any of our colleagues to make sure that you have that link handy, because I know a lot of you, especially in our high traffic service areas, including financial aid, are getting those questions. So you have that link. You can just fire that link right off to that student. They can actually do it right there by their phone. And then we would ask, usually within about 48 hours or so, to follow up with the ITS help desk over in Gandy Hall, because that's where they would actually pick the laptop up. And so they can go over and follow up with them, or as Dr. Jackson stated, can send an email to LUELT, but we want to make sure that their response, that request, meaning that form, has been submitted and filled out first.
Okay, I'm not sure if the link is viewable by everyone, but we'll make sure that we continue to promote that information on how to secure a laptop.
Sorry, Doc. So I just realized that I only sent it to the host and panelists. So I only sent it to Dr. Jackson and VP Powell. I'm sorry. So it should be in the chat now. I apologize, but it should now be in the chat. I sincerely apologize.
That's okay. Okay, so I think those are all of the questions that I see. As always, if there are questions to come up after this webinar, please send them to LUELT@langston.edu. And so at this point, we'll move on to my favorite section, reflecting on resilience, and I'll ask Dean Busby if he'll share this week's topic.
So I'll yield to VP Powell first. Oh, no, this is me. I'm sorry. I apologize. So, hey, look, this weekend, our band showed out. Hopefully, if you all have seen social media everywhere, the Langston University Marching Pride Band went down to Houston, Texas, and I don't want to say competed because it's a showcase, but you can't call it a battle of the bands and not think that there's some type of competition, right? And so they were showcased as one of 8 bands to compete in the Cracker Barrel 2021 Battle of the Bands. They competed against the likes of Jackson State, Southern University, Norfolk State University, and others. And our band did their thing. They showed out, alums showed out in great number. The band, we had over 200 students on the field performing. And from what I heard, unfortunately, I was not able to make it, but thank God for social media and technology. I got to see the entire field show. But I heard we had the best show, hands down, technique, everything. And so kudos to Professor Gordon, to Mr. Allen, to everybody that had anything to do with this trip. We took 5 buses, five buses, charter buses for our band of over 200 students that got to compete. I'm saying compete, that was showcased, I'm sorry, that performed in the National Battle of the Bands in Houston. And so very proud of the work that they did. And then also we were able to take additional 2 student buses, fan buses, who once again, I heard that the Langston section, cheering section was the loudest section in the building, a place that seats over 80,000 people. And that Langston University from Oklahoma represented well. I know President Smith was there and a few other administrators, but and faculty and staff. So we're very proud of the Langston University Marching Pride Band and the work that they're doing in building one of the best, if not, it's actually the best marching band program in the country. So thank you so much to them. Dr. Jackson just put in a poll. We need your support right now. Click on that poll. We got to get our numbers up because there's a poll for, kind of people's choice, if you will. And so you can vote as many times as you want. And so we've got almost 75 people here. So if y'all vote 10 times a piece, we just do the math. We'll gain some ground. And so we just found out about this like late yesterday. Nobody even told us about this. And so we're starting to get this information out. So definitely want you all to participate there as well. And so
it's an opportunity to see a glimpse of their show. So take some time. I think you'll enjoy it.
So I'll move on to the next piece of resilience, and I kind of jumped the gun. Unfortunately, that's why I'm not allowed to have the controls, but we would be remiss if we did not thank Dean Snavely and just for his resilience and his leadership. He is no longer with the university because he took his talents back to the field of law. So he's back practicing law, but just wanted to give him a feature as our focus on resilience and reflections on everything that he did for the university. So thank you, Dean Snavely.
Thank you, VP Powell. Please remember that these are regular webinars. I would also like to pause and welcome our new colleagues. We know that this is the first webinar for several of our newest employees. So we try to do these webinars at least twice a month, sometimes weekly. But they are always recorded, posted on the university's YouTube page, and we generally try to follow up these webinars with a campus-wide message that includes a link to the recording. So if you missed a portion of it, you'll have a couple of opportunities to watch the video in its entirety. So stay tuned for the date of the next webinar. And until then, as always, we hope you have a wonderful week and take care, Lions.